Okay, we'll be starting by talking about the lingual artery. The superior thyroid artery and ascending pharyngeal artery are more in the neck region, so those aren't ones we can mark on our skull. So we're going to start with the lingual artery, and we're going to be using a red puffy paint for that so that it would stick out from the skull like a normal artery would. You may have to put on several layers to get it to be puffy enough, or kind of dab it through there. So the lingual artery is going to run on basically the lingual, through these lingual tissues and muscles, through the sublingual gland. It's going to supply all the suprahyoid muscles. So I just marked that through there with the puffy paint. We will discuss the occipital artery. Again, if we can imagine that external carotid running through here, the branch off that runs behind this mastoid process, flip it over so you guys can see it better, runs through, right behind the mastoid process there, and posteriorly onto the occipital bone is the occipital artery. It has three branches that we need to know. The sternocleidomastoid branch, which supplies the suprahyoid muscles and the sternocleidomastoid muscle on either side. The auricular branch, which supplies the occipital portion of the scalp. And the meningeal branches, which supply the meningeal tissues in the occipital area. So three branches of the occipital artery. Next, we will discuss the facial artery, another division of the external carotid artery. The facial artery arises slightly superior to the lingual artery, which was kind of weird on the back side here. I have to look on yours, right on the inside there. And it branches off anteriorly. It terminates way up here at the medial canthus of the eye. So this one has 5 branches. We have the ascending palatine branch, which supplies the soft palate, palatine muscles, and the palatine tonsils. We have the submental branch here, and it supplies the submandibular lymph nodes, submandibular salivary glands, mylohyoid muscle, and the digastric muscle. The inferior labial, right here, just as it's described, it's the lower lip. So it supplies lower lips and muscles of facial expression. The superior labial, which is here, supplies the upper lip, and then the angular artery, which is the termination point of the facial artery, is at the side of the nose here, where that medial canthus is of the eye. So that completes our facial artery and its 5 branches, again using the red puffy paint to mark those. Next is our posterior auricular artery, which is here, and it is again a branch of our external carotid artery. It is going to be superior to our occipital artery and superior to the stylohyoid muscle that runs here. It arises at the level of the tip of the stylo process, and it passes posteriorly. It has 2 branches. We have the auricular branch, which supplies the internal ear, and then the stylomastoid branch that supplies the mastoid air cells. So just a small kind of branch off of there for the posterior auricular. Next, we're going to discuss the maxillary artery, which is one of the largest arteries that branches off of the external carotid artery. It runs on just right here, kind of along the neck of the condyle, kind of in that area. It's going to be on the medial side, kind of right behind that, and it actually runs through the parotid gland. The first branch off of this is actually, we're going to show it here, is the middle meningeal branch, which actually enters the brain technically through the foramen spinosum, which we could see on the underside of the skull there. But just for visualization purposes, we're going to put it here, but just knowing that does enter through the foramen spinosum. We also have, if we go back to our mandible, the next branch will be our inferior alveolar branch, which runs through here into that mandibular canal. There's a little lingula right there. The inferior alveolar has branches, including the mylohyoid branch here, and that arises before the inferior alveolar artery enters that mandibular foramen, so it's going to rise. It travels in that mylohyoid groove that we talked about when we learned the bones, and it supplies the floor of the mouth and the mylohyoid muscles. The mental artery, if we flip this over here, we've done a good job smearing it. The mental artery actually is another branch, and it exits through this mental foramen here, and it also arises from the IA artery in the mandibular canal and exits through this mental foramen to supply the apices of the first and second premolars, tissues of the chin, and it's going to anastomose with our inferior alveolar artery. So this one and this one, they're going to communicate with each other. Also, if we flip it back to the inside, we have the incisive branch. So after it will go out into the mental branch, and then as it continues to go through the mandible, it becomes the incisive branch. So it stays in that canal, and then it divides into the dental and alveolar branches. It supplies the pulp tissue of the mandibular anterior teeth, so those front teeth on the bottom. Okay, and then next, if we look again at the outside of our skull, we have these couple arteries here that we marked are the deep temporal arteries, and they supply the temporalis muscle. And if we look on the inside here, I've marked the pterygoid artery, which supplies the medial and lateral pterygoid muscles. We have next the masseteric artery, which supplies the masseter muscle. And then we have the buccal artery here, which supplies the buccinator muscle. Again, a little bit sloppy with my paint there. You guys are probably going to be a little more perfect. So next we will go up here to the PSA artery, which is another branch of the maxillary artery. It branches off of the maxillary artery, like pointing right there. It branches off of the maxillary artery. It's hard because the artery isn't actually on the bone like this. It's kind of doing its own thing. So imagining the PSA, the posterior superior alveolar, or the PSA artery branching off the maxillary artery as it leaves that infratemporal fossa and enters the pterygopalatine fossa, which is here. It's going to enter the PSA foramen. So you can kind of imagine it kind of coming like this. So I've just kind of drawn it in down here as it enters the PSA foramen on that maxillary tuberosity. And it is going to also anastomose with our anterior superior, which we'll discuss here coming up, the ASA artery. The PSA, or posterior superior alveolar artery branches, include the dental branches, alveolar branches, and branches that supply the maxillary sinus. Okay, next we have the infraorbital branch, the infraorbital artery, and it branches, it's right here, and it branches off, and again, it's not actually on the outside of the bone, it's actually kind of inside there. It branches off in the maxillary artery in the pterygopalatine fossa, which is here, and it sometimes shares a common trunk with our PSA artery here. So it enters into the orbit through the inferior orbital fissure. So that would be in here, and it travels in the infraorbital canal, and it gives off the orbital branches and the ASA, or anterior superior alveolar branches. The ASA branch, as we talked before, anastomose with the posterior superior branch. It also has dental and alveolar branches as well. Next, we have the descending palatine. So I've kind of just drawn it in here. Again, if we, ideally we have the artery right here. So we just have to kind of pretend like this is a continuation of this. So the descending palatine travels to the palate through the pterygopalatine canal, which if you open this up, there would be a canal in there. Okay, and then if we flip this over, again, it's not on the outside of the bone, but it does terminate where we have the greater palatine foramen and the lesser palatine foramen. It terminates into the greater and lesser palatine arteries. Okay. The next area, again, just being careful not to smudge your paint. Again, hard to draw it on, but the sphenopalatine artery is going to kind of branch off anteriorly to the descending palatine artery, and is the terminal branch. It's the terminal branch of the maxillary artery that supplies the nasal cavity. So even though it's drawn here, really it's, in the nasal cavity. And then it also accompanies the nasopalatine nerve, which we'll talk about later, through the incisive foramen here on the maxilla. So nasal cavity and then into the palate there. The last one that we'll discuss is the superficial temporal, so we'll go to that next. The final branch of our external carotid artery is going to be our superficial temporal artery. So it actually arises within the parotid salivary gland here, and is sometimes visible under the skin in the temporal region. The superficial temporal artery branches include the transverse, right here, this little guy, the transverse facial, which supplies the parotid gland duct and nearby facial tissues. As we move up, this next one here is going to the middle temporal branch, and it supplies the temporalis muscle, and just like these guys do from our maxillary artery. And then we have the frontal branch, which supplies the frontal scalp, and then we have the parietal branch, which supplies the parietal scalp.